So this is my presentation on Unit 18, Health Promotion. So what is health promotion? According to the World Health Organization 2023, health promotion is the process of enabling people to increase control over and to improve their health. It moves beyond the focus on individual behavior towards a wide range of social and environmental interventions. So according to GovUK 2020, there's various public health issues currently in the UK, such as antimicrobial resistance, smoking, preventing STIs and reproductive health, air pollution, alcohol and drug misuse, dental health, mental health, and obesity, food and physical activity. So some aims of health promotion campaigns are reducing the levels of an illness or disease, reducing levels of crime, for example, preventing drug and alcohol misuse can then lead to less theft and violent behaviour, promoting vaccinations and screening programs, such as currently decreasing uptake of cervical screening, according to NHS Digital 2021, and prevention of rather than treatment of things such as obesity saves money for the NHS and the government. So the first campaign I've chosen to talk about is Keep Antibiotics Working by Public Health England, launched in 2017 and again in 2019. This campaign aimed to alert the public to the risks of antibiotic resistance and taking these drugs unnecessarily. So due to antibiotic resistance, infections, medical procedures and operations could become life-threatening, which is why this is really important. So as you can see in this picture, GovUK has stated that if this problem is not addressed by 2020, there could be 1.1 million of avoidable deaths worldwide, and the treatment of those with drug-resistant infections will cost the global economy around £66 trillion. So according to GovUK 2018, 38% of people still expect an antibiotic prescription from the GP, even if the problem, such as a cough or chest infection, is most likely viral. So this campaign urges them to follow their doctor, dentist or pharmacist's advice. So as shown in this diagram, antimicrobials are medicines that are used to prevent and treat infections caused by pathogens such as bacteria. Resistance then happens when the pathogens mutate until they're no longer destroyed by drugs to which they previously responded to. So Keep Antibiotics Working included TV, radio and social media advertisements about the risks of antimicrobial resistance, posters and leaflets in pharmacies, GP surgeries and hospitals urging the public to follow health professionals' advice, the ability to become an antibiotic guardian, which means choosing pledges on how someone can personally help contribute to tackling antimicrobial resistance, for example, having conversations with patients or educating family members. eBug, which is a free online resource for children and young people, which educates them about infections and antibiotic use. And Target, which is Treat Antibiotics Responsibly, guidance, education and tools. So according to the UK Health Security Agency 2017, this includes resources for primary care teams, which can then be used to support the responsible use of antibiotics. And I've included here some examples of posters which were used by the Keep Antibiotics Working campaign, saying things such as antibiotics don't work for everything, discouraging people to ask health professionals for antibiotics for viral problems, for example. So results of Keep Antibiotics Working. So while I couldn't find any surveys that directly relate to the campaign, according to GovUK 2022, in England, total antibiotic use fell by 15.1% between 2017 and 2021, from 18.8 daily defined doses per 1,000 inhabitants per day of antibiotics to 15.9. So Keep Antibiotics Working was released in 2017. So it is likely that this campaign was at least partly a reason. However, another likely reason for less antibiotic use during this time was reduced rates of infection due to less socialization during COVID-19 lockdowns and restrictions, or less use of healthcare settings such as GP surgeries, and because of that, reduced requests for antibiotics for more minor problems. So as you can see here, general practices provide 74% of antibiotic prescriptions. So the fact that antibiotic use decreased there is good. But this reduction of antibiotic use was not seen in secondary care, as you can see here in this diagram. Antibiotic prescribing continues to increase in secondary care in England. So the second campaign I've chosen to talk about is Every Mind Matters by the NHS. So this campaign aims to support everyone to feel more confident in taking action to look after their mental health and well-being by promoting a range of self-care actions, according to Local Government Association 2023. So this is important because only 17% of people in the UK surveyed by the Mental Health Foundation 2017 report living with high levels of positive mental health. So according to NHS 2023, bad mental health and depression can lead to things such as social isolation, no life enjoyment, low self-esteem, and these things can then be a problem with things such as forming relationships and staying in employment, which can further disadvantage individuals. And bad mental health can also increase the risks of diabetes, heart disease and stroke, according to the Centers for Disease Control and Prevention in 2023. So this here states that 500,000 adults in England are affected by severe mental illness, and 1 in 6 adults will experience a common mental health problem such as depression. So this is a campaign which affects a lot of people, which is why it's important as well. And this diagram here, taken from Public Health England, states that mental health can again affect employment, and that it states that 50% of employment support allowance claimants do have mental health conditions, showing that mental health problems can be a barrier to accessing employment, which is why it's important as well. So the Every Mind Matter campaign included, so its main tool is the Mind Plan, which asks the user 5 simple questions about their mental health priorities and any concerns that they have. And an action plan is then made based on their answers. There was also TV and social media adverts, including those featuring celebrities, posters and leaflets in healthcare settings in places such as schools, as this targeted young people as well. So the website also included advice on well-being, what to do if mental health deteriorates, supporting others with a mental health condition, and what to expect when accessing mental health support services. And there was also information for young people about mental health advertised through schools and social media. And I've included here some posters from the Every Mind Matters campaign. I've got one from the lockdowns during COVID-19, saying that every mind matters now more than ever. Obviously, during isolation, people's mental health can be getting worse. So the results of Every Mind Matters. So to date, over 3.4 million mind plans have been created, according to Public Health England 2021, showing that the campaign has been successful in reaching a large amount of people. However, the mental health of children and young people deteriorated between 2017 and 2021, according to NHS Digital 2021. So because this campaign was launched in late 2019, any positive differences that it had made to mental health would have likely been counteracted by the restrictions of the COVID-19 pandemic, which made many people's mental health worse. So this timing makes it quite hard to judge the real success of this campaign, as data about mental health after the release of the second campaign in late 2021 is not yet available. as it states here, the mental health of 6 to 23-year-olds has deteriorated. So rates of probable mental disorder in children have increased from 2017 to 2021. So this could be a positive change due to the increased awareness of mental health, but it may also be negative if problems such as stress are attributed to depression or anxiety, while they may have a simpler reason. So when it comes to adults, according to the Office for National Statistics 2022, between July 2019 and March 2020, the prevalence of depression was 10%, but it was 21% by January to March 2021. And then by September to October 2022, this had fallen to 16%. So this is a year after the second Every Mind Matters campaign was released, suggesting that it might have played a role in decreasing the rates of adult depression. So in January 2022, the NHS released a further campaign called Help, showing that mental health was and still is a challenging public health issue which requires continued focus. I've got here a poster from the NHS 2022 mental health campaign, Help. So the campaign that I would choose to include is Sugar Free Smiles, which is a diabetes and dental health campaign. So I have chosen this because according to Diabetes UK 2023, those affected by diabetes are not entitled to free dental treatment, but diabetes includes the risk of periodontal disease, for which the reason is not yet known, and tooth decay. And also experiencing hyperglycemia leads to more sugar in the saliva, which creates a breeding ground for bacteria. Gum disease may increase blood sugar levels, which can exacerbate any complications of diabetes, such as heart, blood vessel, eyes, kidney and nerve problems. Management of hypoglycemia using Lucozade, orange juice or sweets can damage teeth and gums, again by increasing the level of sugar in the saliva. So I found a picture here showing how much sugar is included in Lucozade, and obviously this will be really bad for dental health. NHS dentists are in extreme shortage according to BBC 2022, and prices for private treatments are often unaffordable. So bad dental health, which the risk of is increased for diabetic patients, could result in lower quality of life, such as pain, further complications, financial problems. I've got again here a picture of NHS dental charges. So band 1 cost of treatment is £23. This then goes up to £865 and then £282 for band 3. Obviously this is not affordable to many people, and people affected by diabetes are more likely to experience dental problems, which means they could then experience financial problems as a result. So the aim of my campaign is to inform about the connections between diabetes and dental health, encourage those affected to look after their dental health and diabetes as one does affect the other, and advise on ways to minimize oral damage when treating hypoglycemia. So to promote my campaign, I have chosen to include posters and leaflets in primary care, dental practices, hospitals, especially any diabetes and endocrinology wards and outpatients. And I would include statistics about the rates of dental problems in people affected by diabetes versus the rest of the population. Information and adverts on healthcare settings, social media and Diabetes UK. This could include links to real people's stories or videos about how diabetes has affected their dental health, which shows those watching that the consequences could be indeed serious if no action is taken, which fits in with the health belief model. Perceived threat. So people will see that if they don't look after their blood sugar levels and dental health, that their dental health could deteriorate, which is more likely to make them take action if they think that there is a real threat to their health. So I'd collaborate with any social media diabetes focused support information groups so that my campaign reaches a wider number of people. I'd include leaflets which could be sent out to home addresses from GP surgeries, dentists or hospitals, showing a team approach if it's sent by more than one of those affected. So I'd send them out to those affected by diabetes, which would include information and invitations to group talks and workshops. So these could highlight the need for good blood glucose control with activities such as measuring the sugar in various drinks such as Lucozade and orange juice, and maintaining a visual representation by putting the same amount of sugar in a plastic bag, and then explaining how such a large amount of sugar can damage teeth and gums if consumed too often. Ways of minimizing oral damage while treating hypoglycemia would also be included, such as sipping Lucozade or orange juice through a straw instead to minimize teeth damage, or eating something neutralizing such as cheese after consuming food and drink high in sugar. So if patients are visiting their doctor or nurse during the time this campaign is running, they can personally speak to them about diabetes and dental health and personally invite them to the workshops. I think workshops would be a good option, as in smaller groups of people, the patients will be more confident to ask any questions, and if the activities are also run by a known health professional, which they normally see about the diabetes, those who are introverted would feel more confident speaking to someone who they already know. So the groups could be broken down into different ages, such as children, teenagers, young adults, adults and older adults, so that the communication style can be adapted, and information sessions for parents of children with diabetes would also be included. So this campaign will run for 3 months starting from mid-June, which is the end of Diabetes Awareness Week. So diabetes will be likely to be a topic still in everyone's mind, and people may be more likely to take an interest in the campaign if they have a family member or friend affected by diabetes, and those affected by diabetes may be more likely to be thinking about their own health around this time and may be more likely to want to make a positive change. So the evaluation of my campaign would include questions such as what proportion of those affected by diabetes have had a 6 monthly dentist checkup compared to before, what are the rates of dental problems in diabetic patients compared to before, what was the uptake of attending group sessions or workshops of different age groups, has this also varied by economic background, location, ethnicity or any other factor, and how can this be improved? So I would include questionnaires given out on completion of group sessions, questionnaires given out or sent to home addresses by GP, hospital staff or dentist to diabetic patients about the campaign awareness. Surveys can also be on healthcare settings social media pages or Diabetes UK, or I'd include posters with links to surveys such as these. And these findings would then be published in a report to advise further action and presented to dentists, primary care staff, diabetes and endocrinology staff.